Hello, dental assistants. My name is Ms. Tenora, and I'm your instructor today. And we will be focusing on Chapter 38 on restorative material and the different instruments we have to use while restoring an actual tooth that has decay. Okay, so before we get into the chapter, um, I, this is something that we absolutely have to learn the, or even understand before we actually get in the office on what exactly is a restorative material and why do we restore teeth. Also, if you were not able to attend this lecture, it will be posted on Edmodo. You want to make sure that you follow up and view the entire video and answer the following questions. Okay. Um, I will be lecturing from your green textbook, and I will start on page 892, which is where chapter 38 is at. Okay. Feel free to message me or contact me between 8 a.m. and 4 p.m. for any questions or concerns to this chapter. Okay. Let's get started. I'm gonna go ahead and share a few PowerPoints so we can focus on the actual objective of the day. And this will help us understand what exactly we are discussing in chapter 38. Chapter 38 focuses on a direct restorative for teeth, okay? Direct means straight to it. We don't have to wait. You come in, you have a cavity. We can go ahead, take an x-ray, see if we can fix it with a filling. If we can, get the tooth open, remove all decay, and replace that actual material inside the tooth to restore that patient's tooth or even yours, okay? The first material we're gonna get into, it focuses on amalgam, restorative material, and there's different materials amalgam consists of to actually restore the tooth, okay? First, let's talk about amalgam, okay? Amalgam plays a big part. You know, dental amalgams is known to be used common, and it's successful when using to restore a tooth, okay? First thing that's important about an amalgam filling is that it can only be placed in posterior teeth. What are posterior teeth? Posterior teeth are anywhere from this section all the way to the back to your big molars. Okay, so you have first and second premolars, and then 1 through 3 molars. Now, your third molar, which is better known as the wisdom tooth, you may not have those. You possibly got them removed, or if you're a little younger, maybe it didn't come out. Even you can even be older and they don't come out. It could be impacted. That could be a reason why you haven't those teeth haven't erupted yet. But remember, amalgams can only be placed on posterior teeth. From here, your first and second premolar, okay? Then you have 1, 2, and 3 molars. Remember, your third molar is your wisdom teeth. That's what it's better known as, your wisdom teeth. You may or may not have them. And it's okay. You can live without them. Okay. So let's get into amalgam. Let's get into the types of amalgam. Okay. The types of amalgam that you will run across, they will come in this form of these little pellets that you see in my picture. Okay, so what's inside of those capsules is actually a form of mercury and a liquid. The mercury is different things like silver, tin, copper, zinc mixtures inside of the mercury. Those things are all placed inside of these capsules. Okay, um, so you want to make sure when we're mixing that amalgam, we mix it properly so that the patient doesn't get exposed to any harmful part of mercury. Okay. Now, a while back, there was a concern that the amalgams had all these issues with the mercury, but hey, They got that under control. Okay. So just for a second, I'm going to turn and I'm going to flip to page 189 and I'm going to show you exactly what I'm focusing on. Okay. Just a second. Okay. So I'm sorry. It is actually page 893. Okay. So let's get back to an amalgam. So the amalgam over time, it can last a lifetime, but it's not guaranteed. Over time, it will expand inside of the tooth. And what that means is sometimes you go from having a little tiny amalgam place where we actually remove the decay. It could be as small as a little dot. Over time, it will kind of grow and expand. It doesn't mean that it's going to damage the tooth or cause that patient to have any more issues. It just means over time it does kind of grow and expand. Now, one thing about it is you actually have to take care of your teeth to try to get the longevity of the amalgam. And that means flossing, brushing, trying not to chew on hard things. If you have it on the occlusal surface, and that's the surface where you actually bite down and chomp down on, foods such as ice, bones, hard candies, sticky candies, things like that can actually crack the amalgam. Now, if you're not gonna, if your patients don't brush and floss and properly clean those amalgams, what'll happen is it'll begin to tarnish over time. Okay. Now, those are the properties and what you should understand about the material. Um, one, I want you to understand while working and placing that material, and these are some of the properties of it. We want to make sure that we're helping the doctor where we're suctioning and keeping that area, cleanse and clean and dry so that the amalgam doesn't get wet in the process of putting it inside of the tooth. We can put the amalgam on both posterior teeth, whether it's primary or permanent. Primary is the baby teeth. Permanent teeth, that's when you get your large adult teeth. Okay. Sometimes it will cause sensitivity to the tooth. And I'm reading this actually from page 889 in once again, your green hard textbook. Okay, so make sure you're highlighting those points. If your patient, once again, has poor oral hygiene, meaning they're not brushing properly, over time, it will definitely tarnish and cause a bad odor, or even cause that filling to tarnish or cause corrosion and fallout or cause another cavity. And you may find that more patients may consider doing amalgams on their posterior teeth. One, because it's a little more sturdier than your composite, and it's, the least expensive restorative method that's on the market today. So that's all your properties that you would actually need to know for the actual amalgam. Okay. Now let's talk about the manipulation part of it. Manipulation means how do we mix it? What's in it? What's actually put into mixing it properly? Okay. So mixing it properly, one, let's talk about the trituration in it. That trituration means it's a mechanical meaning. That's all it is. That means that what you see right here in this picture, this is called an amalgamator right here. Okay. The amalgamation is a chemical reaction that takes place when we're actually forming the amalgam. Okay. We have to use special instruments, special equipment to mix the amalgam properly to get that bond so that the amalgam, once we place it inside of the tooth, actually attaches to the actual tooth. Okay. So what we have to do is we place that capsule Inside of the amalgamator, we have to close the lid. You set the timer. It could be anywhere from 10 to 15 seconds. It'll be your doctor's preference on what they want the amalgamator set on, okay? So if you look here, I'm gonna get my pen. And if you look here, once that amalgamator has properly mixed that amalgam capsule, you're going to place the amalgam inside of the well. Then you are going to use your amalgamator here, your amalgam carrier, to place it inside of the tooth. So I'm going to say that again. We remove the decay out of the tooth. We place the capsule inside of the amalgamator. Okay. From the amalgamator, we place it inside of the amalgam well. The well just holds the amalgam in place so that we don't lose it. It doesn't roll off the tray onto the floor. That's what is the purpose of it all. We are going to use this particular amalgam carrier. So you have a head here and you have a head here, and we're going to fill each head with all the amalgam inside of the actual carrier. We take that, and that's how we place it inside of the hole where we remove the decay. So inside of the hole of the tooth surface, that's where we're placing the amalgam. Then we have this particular instrument here that is that has two heads on it. It's called two-handed instrument. This is what you call a condenser. The condenser is used to pack the actual amalgam inside of the tooth. Earlier you heard me talk about the bond. The condenser helps bond the composite to the actual tooth. Okay? So that's the whole manipulation of anywhere from mixing, what's in it, everything. That's the whole setup for an amalgam. Okay, we talked about the amalgam bond. Now we understand that in order for it to bond to the tooth, we have to use the condenser to make them bond together. Now, when we're placing that amalgam in the tooth, it will be soft like a cream. And it does take a full 24 hours to get actually hard over time, okay? So we would tell the patient, make sure you don't eat on anything hard, or, just don't eat on that side for 24 hours until that amalgam is hard. Okay, once we've done with that, the procedure is done. Okay, so I'm gonna go ahead and erase this. I hope that gives you an understanding on exactly what we're actually using that amalgam for, why, and why it's actually called a direct restorative material. Now, let's get into the composite part. So your composite, you can turn your page to, if you turn to 896, it does get into all your different steps on how the actual procedure starts with the amalgamator, and I will post a video on that, but for right now, that's what we're going to focus on. On page 896, it starts talking about the procedure of using the amalgamator, where you're placing it, what goes first, what goes second, what goes last. It even shows you a picture in figure 38.4 on what the filling actually looks like when it becomes tarnished and there's corrosion. It looks very bad if you look at figure 38.4. Okay, now let's talk about your composites. Your actual composite material is a tooth colored filling. Okay, it's a little different from your amalgam, because if you place it inside of the tooth, what actually happens? You really can't tell if there's a filling there or not, because whether your teeth are bleach white, we have composite colors that are white. Whether your tooth has tints of yellows and grays, we can match the patient's tooth with that material, so that you never know if there is actually a filling there or not. So hopefully that makes sense for you. So your composite material, of course, it's another direct restorative material. And what you'll learn in this particular section is the manipulation, just as you did for amalgam, and the properties of a composite. So let's talk about composite. Okay, a composite filling, guess what? It can be placed in anterior teeth and posterior teeth. What are anterior teeth? So here in your smile line, this right here is your anterior teeth, okay? Your posterior teeth, remember, it goes all the way to the back. From here, first molar, all the way to the very last molar. Premolars, molars, okay? Now, they can come in a flowable material, or flowable means liquid form, kind of like a creamy liquid, and they can come in a packable form, which is the consistency of, you know, if you have a Laffy Taffy, it's really not soft until you start chewing into it. So it kind of has the same consistency. Now, before amalgam, we have to actually put it inside of the amalgamator and mix it. Well, you don't have to do that for a composite. What happens is we only use the amalgam, one, like I said, if the patient chooses. It is not, it's a little bit more expensive than the composite, but we can put it on any tooth if the insurance pay for it, or even if the patient is willing to pay for it, okay? How do we place it inside of the tooth? Well, once again, we are going to clean the tooth out. We are going to, we're going to etch the tooth. Etch means drying out the tooth. You'll learn what the etch is the more we get into this chapter. But we are going to dry out the tooth, okay? If you turn to page 901, it starts showing you the different steps of the actual composite, okay? So it can be flowable, as I said, or packable. It just depends on your doctor's preference. So from page 901 to 9, I'm gonna say 905, it kind of goes through the different steps of your composites and restoring the tooth. But I want you to remember that it's a tooth color filling. It can be flowable or packable. We are going to etch, dry out the tooth. We have to use a bond. We're gonna bond. Bond plays a part of a glue. So it's kind of like we dry the tooth out, we place the glue, we take a curing light that hardens that glue, then we put the filling in. We have to use a condenser to pack and shape and smooth the actual composite out. And then we're going to use that light again to cure that filling to make it hard, just like the tooth structure. It can break. It can last for a lifetime if you take care of it. But if you don't, it can, you know, tend to, I'm not going to use the word tarnish, but it can collect stain. It could change color over time if you are drinking dark drinks such as wines, cokes, Dr. Pepper, eating things with dye in it, color dye, like some food has color dye in it. Those things can stain. So we're not brushing after we're drinking these things, eating these things. It will definitely stain the actual tooth. It's just kind of how it goes. Okay. Let's move on. Now your glass artery, that is one, it's used as an antiseptic restoration, okay? It's used commonly, and it's kind of one of those restorative materials that can bear almost any area in the mouth. meaning any area in the tooth surface, any tooth surface, okay? Sometimes your different glass atomies, those only come in like an olive, off color, restorative color. Some can be close, but it's not as camouflage as a composite, okay? So we know it does come in a fluoride, flowable type of form, and it has to be cured. In order for it to dry and be hard, we have to cure it with a light. We can place these particular type of fillings in certain areas, in some or more, you know, as you see right here, it does say that it's not suitable for all areas that requires strength. So, for example, our front teeth, we actually cut into, I'm going to use a carrot, okay? We have a carrot, we have to bite into it. So our front teeth, our anterior teeth, that's what we use to cut into the carrot. Our molars, our premolars and molars are what we actually use to mash the food down in order to swallow it. So let's just say if it was a buccal or facial filling that we had to restore, whether it was the fronts of the teeth or the surface of the tooth that actually touches the cheek, I guess it would be okay for that. We don't use those areas to smash or cut our food, right? So that's pretty much the restriction on the glass part of it. Now, it says right here, mostly used on class 3 and 4 for permanent teeth and all types of restorative material on the primary teeth. It does talk about the different classes. Let me just tell you on page, let me go back a little bit. It does start talking about your different levels, anywhere from page 895 to about Okay, so it starts talking about it on 895 and all the way to page 907 on the different classes. It's the different classes meaning the different surfaces on the tooth. That's what the different classes mean. Okay. Next, here's your dental question. It says, for what are packable composites most likely used? So for what tooth, for what area, can we put composites on all teeth, anterior and posterior teeth? Or can we just put it on posterior? Can it just be on anterior? That's something that I want you to think about when you're answering this question. And I hope that kind of sums it up and breaks down what we're focusing on today. So remember, we have amalgam and composite fillings. They're both restorative material, okay? All right, your amalgam is silver, can only be placed on anterior teeth. Nope, I'm sorry. It can only be placed on posterior teeth, okay? Your composites, it has to be cured with a light, and that means it has to get hardened with that light, that special lighting, and it can be placed on posterior and anterior teeth, okay? So I'm gonna go ahead and close it out here. So hopefully that gives you a understanding on what exactly we are focusing on this first part of restorative material, okay? There will be a few questions that you actually have to answer. So if you have any questions, please, please, please get to me. I tried to give you as much information as I could to make you understand the different materials. So if there's something that you feel like you have more questions on or that you're not understanding, please, please message me or call me between 8 a.m. and 4 p.m. So thank you for your time. Until next time, hope you guys have a wonderful day. And you can do this. I believe in you. And most of all, if there's something that you don't understand, please, there's always a way to figure it out. Contact me and we can go through it. Till next time, you guys have a good day. Bye bye.